All right, welcome back, everyone. So in this video, Gabe and I are going to be discussing the physical considerations related to the ejaculatory process, and particularly with premature ejaculation. So, Gabe, let's talk about the sexual response cycle first to get everyone oriented to what that is, and then we'll go from there.
Yeah. So a lot of this research was done, if you've ever seen Masters of Sex, right? So it's an entertainment story about some of the researchers, Masters and Johnson, who did a lot of the early work in sexual health and understanding the sexual response. And lots of people have added to that over the years. But generally, for men, we kind of think of the response cycle as starting with desire or interest in sex. And as you engage or as you approach sex, for men in particular, oftentimes arousal can begin before any actual contact has been made with a partner. And so arousal can begin, and through the arousal process, when there's stimulation, oftentimes that's when we start to see an excitation or a buildup toward a climax. So climax or orgasm is where there's oftentimes an ejaculate, or where you feel kind of the pinnacle of the pleasure during that engagement. And then for a lot of men, not all men, but in a lot of situations, there's a refractory period after the orgasm, which is basically where the blood that has made the erection drains back out, and it can take a little bit of time sometimes to get it to come back. Yeah, I mean, that's the basic system, but we're talking about the physical considerations. There are a lot of pieces, I bet, that play a role in premature ejaculation. Tell me a little bit about the pelvic muscles, and let's just start off there.
Yeah, oh my gosh, my wheelhouse. Hey now. Okay. So the ejaculation process, right? So it starts off with either a psychological arousal, right? Mentally, or a physical genital stimulation. So you have sensory, here's a penis. All right. Just want to say it out there. If there's any touch to the genitals, that will trigger certain sensory nerve endings in the sex organs to send a signal to your spinal cord that then sends a message back out to the genitals, to the nerves, to say, hey, release certain neurochemicals, we're getting this going, right? And so then you'll start to have tumescence, or a blood filling the penis, and then those messages continue to be propagated back up to the spinal cord and obviously your brain, which is the major sex organ. And during that process, though, you will have the pelvic muscles also engaging. So here's a pelvis. Here are the muscles around the base of the penis here. And these muscles, as the pressure in the penis increases, these muscles are also going to increase in their tension. Now, you have a thing called the bulbocavernosus reflex, which is associated with this muscle here called the bulbocavernosus muscle here, that aids in the emission or ejaculatory phase of the sexual response cycle. So when there's a certain increase in pressure that reaches a certain threshold and the point of inevitability occurs, these muscles, or this muscle particular and the surrounding muscles here, are involved in the emission process, squeezing around the penis, squeezing around the prostate to help with expelling semen from the penile urethra.
Yeah, and you mentioned this scenario, this thing that happens. You didn't say point of no return, but that's sort of the colloquial way to talk about it. That where in orgasm or an ejaculation or whatever is going to happen.
So point of inevitability.
Yes, that's such a better phrase.
Well, it's used synonymously, like what you're saying, the point of no return. But once that process has started, there's no way that you can stop it. Now, from my experience, and maybe your experience as well, Gabe, that I find some men trying to physically stop that process, like squeezing their actual penis or pressing on the glands or cupping their testicles or scrotum to stop that process. But at that point, again, and maybe you've advised, but it's just, if it's happening, like I encourage guys to just be present with that process and enjoy it.
Yeah.
Even though it's happening, because that can be very distressing. let's see if we can stay connected to our pleasure and just enjoy that process, right? What can
Right.
happen if we're trying to manually, aggressively stop that process is you can injure yourself.
That's true. And when we talk a little bit more in the future sessions about the psychological, there are some roles that that can play if you're doing a lot of stopping and feeling negative emotions around that. What about the hormone component? So obviously, like the muscles play a role, and there can be some of that, but hormones. What do you think?
Yes. So there's some research around serotonin. If there is a low level of serotonin circulating in the bloodstream, that could certainly impact the ejaculatory process. You also have other hormones that are related to the thyroid system as well. So often, if there is a lifelong um, PE suspected, then so endocrinologists and urologists will look at the thyroid and other hormones that are responsible for the sexual cascade, right? And how that may impact. So we talked about serotonin, some thyroid hormones. Um, Another thing to note with like the neurophysiology of the ejaculatory process is the nervous system, which is all these systems communicate with each other. I just have to say that, like your
Yeah.
hormone system, your nervous system, your musculoskeletal system, your vascular system, all of your bodily systems are communicating with each other during this process. So it's not just, in a vacuum, this part and this part's the only thing that's the problem, right? So
Right.
I just want folks to understand that it is a multifactorial contributing like process. So the nervous
Totally.
system. So you have, if I can kind of just break it down into simple terms, you have the sympathetic and parasympathetic nervous system. The sympathetic nervous system, which is part of the central nervous system, the brain and the spinal cord, is the nervous system that is fight, flight, or freeze, right? So adrenaline, norepinephrine, again, those are neurohormones, neurochemicals. Those are responsible for, when you're ready to, when that point of inevitability occurs or climax and you're reaching that, then that switch becomes the dominant one.
Mm.
That switch has to be turned on in order for ejaculation to occur, or at least more dominant. Then for an erection, for the erection phase and the buildup phase, that's parasympathetic. That's rest and digest. I feel safe. I feel confident. I feel relaxed in my body. I trust, this whole process in the sexual encounter, like that. It has to be the dominant factor in that phase of the sexual response cycle. So with PE, you can imagine if, and you mentioned this already, Gabe, like if we're worried, nervous, anxious about rapidly ejaculating or having a lack of ejaculatory control, that actually adds fuel to the fire in these situations,
Right.
because that actually continues to amplify that sympathetic nervous system, which is propelling the quick ejaculation process.
Yeah. Absolutely.
So pain. So if there's any pain or sexual pain in organs or pain anywhere, that could, again, because if you're hurting, what part of the nervous system is actually more engaged or upregulated? The sympathetic
Yeah.
nervous system, right? It's a big threat. Your muscles are probably already tense to begin with, right? So again, thinking about the pelvic floor muscles and their function with the ejaculatory process, they're already tense and protected and squeezing. So that's going to impact or alter the sensory signaling during any of the sexual phases, right?
Yeah.
And then if there was injury to the sexual organs, especially around like the neurological structures, medications, so withdrawal from certain medications, this has been reported, like opioid medication or pain medication, that can influence ejaculatory control, and other antidepressants or antipsychotic drugs, withdrawal or getting on them could influence any part of that sexual encounter or sexual function. If there's a prostate infection, I already mentioned thyroid issues. And then for some folks, again, some folks have a nervous system that might be just hardwired to go off quickly. And there is some research that speaks to the lifelong premature ejaculation, that there might be some genetic component to that as well. So they're looking into that. So there might be some genetics to that, and how one's body is just wired. But that's a lot of just postulation there. But I wanted to ask you, as far as, well, what about sexual skill, and what about relational distress and other psychosocial factors that are potentially playing into the mix?
Yeah, for sure. So, I mean, I think that there's a major component of kind of getting to know your body. And we talk about this in a lot of different ways with the sexual functioning difficulties, that just because you have the same overall structure doesn't mean that your penis and someone else's penis feel the same way with the same stimulation. And so there might be things that you can cue in on about what feels really good or what makes you get to that climax faster. And sort of as you approach those with a partner and communicate about those things, you can build into your routine with your partner how it might work if I ejaculate too soon. And maybe we go through the refractory period. And maybe by the time we're at a point where we're moving to the next thing sexually, maybe I have another erection and I feel a little less tension or concern moving forward. And that might be easier. So some of it is knowing your body and building your skill in that sense of like understanding what positionally does what for you, or what sort of stimulation impacts that. And we'll probably talk more. The psychological components can play a really big role as well. But in the relationship aspect too, oftentimes we'll see if there's been like a length of time even in between the last engagement. Sometimes a partner get just as very excited about engaging again, and
Great
that can
point.
lead to it, finishing more quickly than you intend.
Mm-hmm. Mm-hmm. Yeah, and it doesn't necessarily mean that that's a pathology,
Right.
right? So I'm so glad that you brought that up. Absolutely. If I could circle back to maybe some sensory signaling that I think is important, and the role again of physiological relaxation
Mm.
for especially around, if we know that these muscles are part of the ejaculatory process, we can certainly use them to our advantage to create relaxation. And again, when there is a stressor or anxiety around a certain sexual activity and process, then that's only going to, as I mentioned, amplify the tension. And perhaps there's this huge myth out there too that doing more Kegels is going to help with premature ejaculation. Like squeezing is going to help. But what did we just learn based on everything we just talked about, right, Gabe? Like
Right.
that's not going to help. Actually, it's going to make things worse. And a lot of the guys that I work with will tell you that, like, it wasn't working. It actually was making things worse. And I said yes, because it may seem counterintuitive to actually relax your body in
Mhm.
that moment, so that these neurophysiological processes are not amplified so quickly, and that we're gradually building up that sexual energy, and that climax. And also, as you mentioned, Gabe, the body awareness of when do you know, how do you know your body, and when do you know that you're getting close to that point, and then what is going on up here and down there, right? This head and that
Right.
head, like what's going on during that moment that may actually just accelerate that process instead of like slow down and inhibit. So I
Right.
just wanted to bring that up again, because I think it's such an important myth to bust around Kegels and pelvic floor
Yeah.
exercises, and that they're the cure all for everything. So
Right. That's definitely something we want to address. That's great.
absolutely. Cool. So, in the next video, Gabe and I are going to be chatting about the psychological contributions to premature ejaculation. So, you don't want to miss out. See you then.
Our brain builds patterns based on our experiences. And so, really, like we can create neural pathways based on repeat experiences. And that can happen from trauma. So, we have neural pathways that are trauma associated. We can build some of those by maybe doing relaxation and things like that, so you can start to trigger relaxation much more quickly.